this video, we will learn about the different methods used by neuropsychologists and how these methods can be applied to answer specific questions about behaviour. The primary method used by neuropsychologists is the administration of neuropsychological assessments. Over the decades, these assessments have evolved from basic single test approaches to standardised and customised test batteries, in which a series of tests are administered and scores on each test are aggregated to form a single score. When neuropsychological tests are used in clinical settings, a score below a certain threshold will lead to a diagnosis of brain damage. Administering neuropsychological tests, however, is time-consuming and must be carried out carefully by following specific guidelines. In fact, many test batteries are accompanied by an administration handbook. Following the guidelines on how to administer these tests is critical for accurate results. For instance, several tests can include discontinue rules, whereby an examinee scores 0 points in 2 successive trials of a test, then the test should be discontinued. This prevents the examinee from becoming frustrated and helps the examiner save time and proceed to the next test. To give an example of the types of test batteries used, let's look at the Wechsler Intelligence Scale, which is widely used for assessing intellectual ability. Although intelligence quotient or IQ scores are a notoriously poor measure of brain damage, a test of general intelligence is nearly always included in a battery of neuropsychological tests given to patients. This is because knowing a patient's IQ can help neuropsychologists interpret the results of other tests. There are several different versions of the Wechsler Intelligence Scale. For example, there is an Adult Intelligence Scale for anyone between 16 and 90. There's a scale for children, aged between 6 and 16 years old, and even a test for preschool children between 2 and 7 years old. The scales have been used in a number of different settings, including psychoeducational assessment, diagnoses, clinical research, and, unfortunately, managerial selection. The first thing to note about the Wechsler Intelligence Scale is that it is designed to give us a score which allows us to infer the person's underlying intelligence. Intelligence scales within a population largely follow a Gaussian distribution. Here, most of the population will fall within the boundaries of an average intelligence, which is defined between a score of 70 and 115. If a person's score is more than 2 standard deviations below the mean, in other words less than 70, then the person would be considered someone with impaired intelligence. Within the Wechsler scale of intelligence, there are 4 index scores representing the major components of intelligence. For example, the Verbal Comprehension Index assesses language ability, such as how well you can describe words or concepts, or even answer general knowledge questions. Language ability can be measured using the similarity subtest, whereby someone is asked how 2 concepts are related. The response is then scored depending on the answer given. Another index of intelligence is working memory. This can be tested using a digit span test that assesses a person's ability to listen to a series of numbers and repeat them as heard both in an ascending and reverse order. In addition, perceptual organisation, which is our ability to see and perceive things in our mind's eye, can be assessed using the block design test, whereby participants are asked to recreate an image using small red and white cubes. And finally, processing speed is our ability to solve problems within a certain time period. This can be assessed using a coding task, whereby a person must transcribe a digit symbol code to solve a problem within a time limit. From these tests, generalised intellectual ability scores can be derived. For several cases of patients, neuropsychologists might need to determine whether or not there has been any generalised impairment of intellectual functioning, and if so, how severe this has been, for example, among people with dementia. As you might have realised, however, the cognitive tests used, such as those in the Wechsler scale, can only measure current levels of functioning. So, how would a neuropsychologist be able to determine a patient's level of intellectual functioning before the occurrence of symptoms of a disease, otherwise known as pre-morbid intelligence? One way is to estimate a person's pre-morbid intelligence is to use indirect comparison standards. Here, factors in the patient's life history can be useful, such as public examination results, general educational history, subjective reports, or occupational histories. However, as intelligence is indirectly inferred, this might not give the most precise and accurate measure of a patient's pre-morbid intelligence. A more direct method is to look at a patient's score on the National Adult Reading Test, or NART. The test requires patients to read out loud a set of 50 irregular words. The responses are individually scored as correct or incorrect according to their pronunciation. This score can then be used to derive a pre-morbid IQ estimate because the assumption is that reading ability is relatively independent of brain damage and is also a strong predictor of intelligence. However, despite the increased objective accuracy given by NART, there are several limitations. For example, it cannot be used for all examinees. For instance, those with poor literacy skills, impairments of speech production, or those with dyslexia. As such, determining pre-morbid intelligence remains a further area of development within the field of neuropsychology.